Histamine is found in certain pockets of fat. It's all related. Cortisol, histamine, and then other inflammatory and immune signals that produce changes in each organ.
Dr. Agnes, welcome back to the show. It is a very rare occasion where I have a featured doctor return to the show, but our last conversation had so much traction. Since then, I've seen you speak at a couple of conferences, and I felt so compelled that we had to continue this conversation here over on the Ageless podcast. Welcome back.
Thank you so much. I'm so happy that you invited me back because I felt the same. It was a terrific podcast last time, so I'm very excited to be here.
This particular episode, we're going to really narrow down our focus, and it's something that I get a lot of questions on. And this is specifically weight gain and also a resistance to weight loss in menopause. So we're not talking perimenopause, we're talking menopause, which is what is the official definition of menopause?
Menopause is when the ovaries stop producing estrogen, but the weight gain actually happens in perimenopause. So it's in that time frame when the hormones are fluctuating. So menopause generally, which is when they stop producing estrogen, the ovaries stop producing estrogen, is generally on average between the age of 45 and 55. But perimenopause can be even up to 10 years before that. And in that time, you're getting significant hormonal fluctuations, estrogen and progesterone are fluctuating. And this is when the weight gain tends to happen. And then it continues through menopause, but it's a combination of so many different factors. It's not just the hormonal fluctuations. They're just revealing a lot of the underlying issues that have sometimes been there for some time, because I know you attended one of the conferences, and estrogen is an anti-inflammatory molecule, and when it fluctuates, or both estrogen and progesterone regulate the immune system. So when they're fluctuating, we're getting changes to our immune function and an altered state of inflammation. So our body becomes quite inflamed, and this then produces all of the disruptions, not just with weight, but it's their multi-system effects, which is why women experience such dramatic changes in their brain, in their weight, in their skin as well. But it's all very much the protective effects being removed from the equation, because estrogen's a very protective and anti-inflammatory molecule that supports the function of all of our organs. There are estrogen receptors in every organ and system in the body. So as it declines, you're getting significant and widespread disruptions.
One of the things that I found really compelling about what you talk about and what you teach is the link between inflammation and weight gain, that it's not simply, and there's a lot of talk about, when we can come back to it, where you put on weight in perimenopause and menopause. But I want to tap into what you touched on about inflammation, and as estrogen levels are reduced during perimenopause and definitely after menopause, if you're not taking menopause hormone replacement therapy, what does that mean in real terms, inflammation?
So in real terms, there are two different types of inflammation. We have acute inflammation, which we need to remove or manage toxins or viruses or bacteria, and that's short-lived. Chronic inflammation is the inflammation that's causing chronic disease, and it accelerates the aging process. And chronic inflammation really begins with an altered gut microbiome, which I know we spoke about in the last podcast, so dysbiosis, where there are changes to the microbiome, because the microbiome releases metabolites that regulate immune function, and all of our 80% of our immune cells are located in the gastrointestinal tract. So the inflammation that begins there is then transmitted systemically, and it disrupts hormones, and it disrupts neurological function, and all of these combined will affect metabolism, glucose regulation, but there's also the local effects in the fat cells as well, because fatty tissue becomes inflamed as well.
I mean, it's such a fascinating conversation, because there's with weight gain and weight loss, people always want a magic bullet. And, obviously with the explosion of Ozempic and Mounjaro and all of the drugs that are coming through too, it's not just limited to those, it offers, for the first time in a long time, it offered a magic bullet. And so in that perimenopause, menopausal state where you are so frustrated by how your body is misbehaving, for lack of a better word, it's just not on script anymore. You know, you've known yourself to have a certain body or metabolism or ability to eat certain foods. As simple as that. Like, you've always been able to digest things in a certain way and suddenly you can't. So anything that can quickly get you back to where you were is very attractive. And speaking with you and working with you, and certainly by following your anti-inflammation diet, which I've been doing now for, I think, 3 weeks, I have learned so much about, I've started to feel what my body feels rather than just blindly going into, you know, just autopilot, I would say. So yes, I would absolutely love for you to educate us on those key things, because I feel like the more you know, the more you can tune in and become quite intuitive about what you need and what's going on. And then you can better advocate for yourself with your doctor or your health professional.
That is exactly it. That's exactly what I hope to do, is to really empower women with that understanding, a different understanding of health, because we have a general overview of it, but a lot of it is quite flawed. And you're so right in how when you said about women just not feeling like themselves, because there are such dramatic changes, and the weight, carrying that extra weight really affects psychology, your psychological state as well, and then the changes in the skin do. So the way it's very complex and it's really multifactorial. So generally the belief is, because that weight is gained in that perimenopausal period, the belief is that it's all hormonally modulated. That's just a small part of the picture, and this is why hormone replacement therapy is really limited in the weight benefits. And so women are looking elsewhere for, and medications like Ozempic, which are glucagon-like 1 receptor agonists, have become very popular. If you want, we can talk about that later. But it's so complex. You have, what happens when estrogen declines is it's just revealing what's been happening for potentially decades. And it's just that the protective effects of estrogen and the anti-inflammatory effects of estrogen have been removed. So then that inflammation that has been down-regulated for decades is just revealed. And so that's why women experience, so you're getting inflammation in the gut. So women are experiencing food intolerances, bloating, various gastrointestinal symptoms. They're getting inflammation generally in the body. So they're experiencing skin signs or accelerated skin aging and rosacea. Rosacea and psoriasis, it really skyrockets in that perimenopausal patient, and skin reactivity. The skin just looks very different. And then they're getting the brain changes and the weight changes. And that's because of inflammation within fat cells. So in the fatty tissue, when fatty tissue is inflamed, it changes the endocrine function of fatty tissues. Our adipose tissue is actually more like a gland. It releases a lot of hormones that then help balance our appetite and metabolism. So
you mean the fat actually acts as almost as its own organ?
Yeah, hormonal gland. Yeah. So it releases one of them. Yeah. So one thing that happens during perimenopause and menopause is that fat cells enlarge. Now, as fat cells enlarge, they release a hormone called leptin. So normally if we're pre-perimenopausal and we're releasing leptin, our brain will sense leptin, and leptin is a satiety signal. So it'll make you feel full, it'll tell you to stop eating. But that doesn't actually happen even in many premenopausal patients, because the brain stops sensing leptin when there's too much of it. So it's almost like a leptin.
So it kind of dulls the senses.
Yeah,
if you've got too much leptin being released.
Yeah. Yes, and because the fat cells are enlarging, they're releasing more leptin, the brain down-regulates leptin receptors. Just like with insulin resistance, the brain becomes resistant to leptin, and it also becomes resistant to glucose. So you feel hungry all the time. So there's no
Is that why one of the side effects or benefits of the semaglutide medication is the modification of cravings for addictive substances? Is that what that is linked to?
It's an appetite suppressant, and it follows similar pathways in the brain to other addictive substances. It's suppressing, or because basically we are in a way addicted to food, because foods are designed to be addictive. Yeah, they're designed to be addictive.
It's so funny. Going back to your program, your My Ally supplements, and then you have a full anti-inflammation program that you offer women, and it's really illuminating. I've been on a diet, I don't reckon since for 20 whatever years. I hadn't even been on a food plan. I hadn't even looked at what I put into my mouth for at least 20 years. So having that conscious awareness of how addicted I am to certain foods and how habitual my consumption of certain foods are. And then when I remove them, how it makes me feel and how it makes me behave, and how I literally suffered from withdrawal symptoms from the silliest things.
Yeah.
Like, I took away tomatoes and like I was dreaming of tomatoes. It sounds really crazy, but you just start realizing how a lot of your behavior is. And if food is the fuel for everything, then it's definitely something you want to kind of get a handle on and know what it's doing to your body. When I was, as part of being on your program, and your program is eliminate first and then reintroduce to see how your body tolerates certain things, and, you know, how it affects inflammation, how it affects bloating, how it affects digestion. It's honestly been the best science experiment I've conducted on my body in my life. I wish I'd learned it in my teens and just understood what food gives me energy, what food makes me feel sick, what food makes me feel tired. It's so interesting. It's literally been the best biotech experience I've had in my life. So, yeah, better late than never, right?
Yeah, that's fantastic. I don't think we're as motivated to do that in our teens anyway, because our repair mechanisms are really managing the damage, and it isn't until you're starting to feel symptoms that you then look for answers. And what we were doing 10, 20 years ago just doesn't work anymore, because of all the damage that's accumulated over time, that you're just not able to repair it at this point in your life. So that really motivates women to make these changes, because they're hard. They're not easy. Your brain is exhausting. Yeah, they're hard. It's not
the habitualness of things that's hard.
Yeah.
It's hard. Yeah. But, I'll just share a couple of like simple things that I've learned from you and the program is just the loop cycle of the brain when it comes to food, and why certain things mean something to you. Like once you start observing why you eat things and when you eat things and how it makes you feel, and if you can kind of go back to when you first started that cycle, it's really interesting, because, if you were trying to change any other behavior and you went back to the source point of, that bad behavior. So it might be when you started binge watching television, you never did it before. And then maybe it was the pandemic and lockdown, and suddenly you found yourself to be binge watching TV. Once you kind of understand where it began, you understand that you're no longer where you were then. And so you can kind of modify the behavior. And I found that level of awareness of going back to the source code and the source point of when that bad behavior started. So, for example, I think a source code or an origin point for dairy is that when we were little, certainly in my generation, your generation, we were told that you had to have milk, you had to have cheese, that you were not going to grow if you didn't have milk and cheese and dairy, that calcium, the only source of calcium was dairy. And so you've shoved all this dairy into your diet from when you were 3, 4, whatever. And then as a 50-year-old, it's really hard to break up with dairy, because your brain is still thinking, oh my God, I'm going to head down straight into osteoporosis land if I remove brie and milk in my coffee and all those things from my diet. But that's not true. That's simply not true.
No, your brains it's so true. And it's these conditioned beliefs, and it's from our very first experiences with food. We're conditioned to believe that certain products, which aren't food, they're they're like science experiments more so, but they are used for comfort and to celebrate and when you're unhappy, when you're sad. So there are these conditioned beliefs around food, but dairy is one that's absolutely considered to be healthy, but only about 30% of the population is able to digest it. We're really after the age of about 6 months, we just don't have the enzymes. The majority of people don't have the enzymes to digest it properly. When you're not digesting, it's just producing inflammation. And we know dairy has been linked so clearly to acne and sinus, like hay fever and that kind of just worsening.
I took Lily off it too, and her skin cleared up. My skin is honestly, in the past 3 weeks, I would say at least 30% better.
Yeah, most
From
people do say
elimination.
that. Yeah, there's that gut-skin connection. I think we did speak about that last time, where any changes in the gut are transmitted to the skin, and the skin will be affected. The same as with changes in the gut will be transmitted to the brain through the gut-brain connection, and they're all three are interconnected. So if the brain changes, your skin changes because the skin and the brain communicate as well through different pathways. Usually the stress response and histamine. So this is why people who, for example, have histamine intolerance, they may not be aware of that, but they're eating it and they're getting depression or anxiety or insomnia and skin rashes or reactivity and gut symptoms, and it's all related.
Can I ask you, speaking of hormones and stress, the role of cortisol in menopause and perimenopause and weight gain in particular areas like around your belly or other kind of sites where high cortisol presents?
Cortisol is, especially when it's chronically released, which is something that does happen in that peri and postmenopausal patient or late female, there are structural changes within the brain and this is seen on scans where women are basically stuck in a stress cycle, and it's a lot of it is mediated by neuroinflammation, and it's that systemic inflammation that I was talking about. It produces a heightened stress response that becomes chronic, and we are chronically releasing cortisol. Cortisol in small amounts is anti-inflammatory, but in large amounts, and that chronic release of cortisol, it's pro-inflammatory. So this is actually what is one of the drivers of that weight gain, and it has to do with receptors being different. There's a concept called fat mapping. We have different types of fat in different parts of the body, and so where there is fat that is more sensitive to cortisol, then you will get more weight gain in those areas, like around the abdomen, back of the arms, upper thighs. So it's more about the receptors that are present in different parts of the body that makes the fat under the influence of a particular hormone.
Are there other hormones or things that affect different parts of the body, speaking of this fat mapping phenomena?
Or histamine, for example. So histamine is found in certain pockets of fat. People who have rosacea and fatty tissue on their face are more likely to have more mast cells and histamine release in those areas. And people with lipedema have mast cells within the fatty tissue. But histamine is another inflammatory molecule that basically drives inflammation, and it's been linked to all chronic conditions, just similarly to certain immune cells. So it's all related: cortisol, histamine, and then other inflammatory and immune signals that produce changes in each organ. And each of the ones that are involved in weight gain, that also means the liver, the pancreas, the muscles, the brain. And the symptoms that occur in each of these are very specific. So in the brain, it can cause insomnia, tinnitus. Women tend to get tinnitus during menopause. But also joint inflammation, frozen shoulder, food intolerances. That's a big one, and that's pretty obvious because you can figure out which foods are causing this type of inflammation. But in fat cells, this is what I find really interesting, is that these mast cells are very sensitive to food triggers. So in people with in the perimenopausal and postmenopausal female, it's quite similar to those with lipedema, where they can eat a food that they're intolerant to. It produces mast cells, it activates mast cells to release histamine, and their fat can swell as a result of the inflammation that's produced within hours of eating that food. So their clothes feel tighter, and it's quite rapid. It's not fat gain, it's inflammation.
Got it.
So it all
Now,
boils down to that.
one of the things that you spoke about at the conferences and you continuously educate people on is how and why weight loss how and why weight loss is harder in this point of time, and some of the things that worked before you're now resistant to. So we talked about the causes, which are, loss in drop in estrogen, changes to your physiological and hormonal states, not just estrogen as the hormone, but other hormones and other changes in the body. But why are we resistant to the things that used to work for us before?
So there are systemic factors like insulin resistance, which worsens in menopause. Again, that's because of inflammation. So inflammation and insulin resistance are really closely linked. There are also further changes to the gut microbiome, dysbiosis, which, as we know, causes inflammation. So there's that. It worsens, dysbiosis worsens during menopause as estrogen declines. Leaky gut is another issue. And then there are the local factors within the fat cells and even within the brain, because weight loss is more than just about the fat cells, but also the ability to override cravings and decision making, which completely changes in that perimenopausal period because of the effect of estrogen decline and inflammation within the brain. So it's so multifactorial. But if we're just looking at the fat itself, you have the enlargement of the fat cells, which produce more leptin. So satiety sensing decline. So that's one factor.
So you're more hungry.
You're hungry, yeah.
So and then you could have a good meal and your brain is still saying, no, I still want more.
Yeah, so that's one. Within the fat, there's also that chronic inflammation causes fibrosis, and it can damage vessels and lymphatics. So even if you're trying to lose weight, even if you starve yourself, I have patients who come and they're eating like 200 calories a day and they're not losing weight. But you've got the inability to shift the fat because the vessels can't remove it, and so that it's oxidized, so that it's burnt elsewhere. And
what about resistance to exercise? Like what happens? Why are people who are continuing with, some like a lot of activity, why are they still resistant to that postmenopausal weight gain?
Well, it depends on the type of activity that they're doing. You can't do what you were doing when you were younger, because as in middle age, there are other hormonal changes. So the adrenal glands will also become a bit tired. So you get the common term is adrenal fatigue, and the medical term is adrenal dysfunction, or HPA axis, hypothalamic pituitary adrenal axis dysfunction or failure. And so there's the issue of cortisol. So if you're over-exercising, cortisol will prevent fat loss. And I see this a lot with people who are having personal training sessions, and that personal training session isn't appropriate for their age. It produces more cortisol, and cortisol causes resistance to fat loss.
So if you're having like a stressy, high impact training session and it stresses your body out, like it's beyond what you are normally used to, that can make you fat.
Right. That can make you fat. Yeah, so and then there's the whole factor of the hallmarks of aging. So one of them is senescence, so cellular senescence, and this happens in all of the organs in the body at different rates. But in fat cells, so senescent cells are cells that don't function. They remain alive, but they don't function. If we're looking at the fat cell itself, fat storage is relatively passive. Our fat cells can store fat quite easily, but to release it, you need well-functioning mitochondria, which declines with age. So mitochondrial function, mitochondria use fat as an energy source to give the cell the energy to perform its function. So that declines, mitochondrial function declines. It also declines in muscles, which really are where it's where fat burning occurs mainly, but the liver and the brain as well. So just a generalized decline in mitochondrial function and the accumulation of these senescent fat cells. So this pattern where you just can't lose weight. So you have to address all of these components that we're talking about, and you have to do it all at once. It's not like you can just It's not like you can just pick and choose. It has to be done all at once. I think it's the reason why my patients are really losing weight quite rapidly, despite not being able to lose it with other programs, is because it's designed specifically to address absolutely everything all at once.
I mean, I'm 3 weeks into kind of being on the program, and I'm taking your My Ally nutritional supplement, which is kind of a supporting mechanism for the gut health and all the big nutrient things. But I would say that, like, by the end of the 6 weeks, the first 6 weeks, I would have done things that I've never done in my life, never done in my life. And it was really hard. It was hard at first, and no one wants to do hard things. So, you know, I've had you on speed dial for a couple of things that, you know, I wanted to kind of navigate past. I do want to say that it's not as inflexible. It's more about your brain, right? It's about saying, okay, I actually want to have optimal energy. I actually want to sleep all through the night. I actually want to have really good skin. And I have to say the payoff of good skin was pretty quick. I feel like my skin really quickly responded. So that kind of reinforced me wanting to stick with it. I do feel like the inflammation, definitely bloating, I've noticed straight away. I never weigh myself, so I don't know if I've lost weight, but I definitely feel like I don't have bloating in the way that I used to experience it. And I feel like after the 6 weeks, I may have kicked some bad habits to the curb. I don't know.
That's great. That's great. Oh, hopefully your experience, I think a lot of it has to do with the brain changes. Supporting brain function with those extra supplements is what I've found in my clinic to really make a difference in how rapidly the cravings reduce and how rapidly you feel emotionally okay and focused and better clarity. So that helps the process. And I know there is, for someone who's never dieted, it is restrictive, but a lot of the people I see, they've tried everything and they've dieted and restricted so intensely. Whereas here, this is about health. The focus is in
there's no kind of
it's not about, no. It's all about portion control. It's about the right food for your body, which of course is different for everyone because everyone has a different inflammatory and metabolic and hormonal profiles. But when you get the right food in, because our body has this incredible potential to heal if it's given the right inputs, and that comes from diet and lifestyle and environment. There's so many factors that you do need to work on. When you get it right, the potential is just quite limitless almost. And I think I always tell patients and through the program the focus is on health. We know that what you were doing wasn't working. This might be hard for a couple of weeks. It might not feel right for a couple of weeks, but it's not going to feel right for you for the rest of your life if you don't make the changes. That's the reality of it. You know, you come to a fork in the road and you've got a choice. You can stay as is and get worse or get worse.
So when you talk about metabolic diseases, it's not just weight, is it? It's things that we've done to our body and our systems with poor diet and incorrect nutrition. Is that correct?
Yeah, that's right. It's not just weight, because whatever we're eating, because some people can be of completely normal weight and still be very unhealthy and still have insulin resistance. And it all has to do with the wrong types of food. It may not be the amounts, but it's the wrong types of food that are causing inflammation, increasing oxidative stress, and even accelerating aging. You know, that connection, the connection between aging. And that's accelerated with the wrong diet. And of course, the type of diet, especially in the during middle age, this is men as well, is very different to the type of food that you would be able to consume. But there are certain healthy foods that will cause problems in some people once they hit that middle age period. And they can continue to cause oxidative stress and accelerate all of the hallmarks of aging. So it's about getting your nutrition right, because when you do, then everything else seems to fall into place. It's much easier to then go for a walk because your energy's recovered, and it's much easier to practice some stress management techniques because your brain is improving. And then that everything else that you layer on top of that will just boost the benefits even more.
For those of you who are listening in who've never heard me talk about this program, Dr. Agnes has developed a personalized nutrition plan. So you go on her website, you do a questionnaire, and then it gives you a personalized nutrition plan. You don't have to, buy any supplements or anything, but if you wanted to, you can also get a supplement of My Ally, which is a food and nutrition support supplement. But I'm wondering, Dr. Agnes, could you talk us through how you do a personalized nutrition plan through a questionnaire?
Okay, yeah. So I know I've been doing personalized nutrition plans for about 15 years, over 15 years. And what I found over this time is that there are symptoms that indicate a specific type of inflammatory response, like an allergic one, an autoimmune response, or a basic inflammatory response, which is, for example, obesity can be just a basic inflammatory response, but then someone can have autoimmune response in addition to that. So it's about identifying the type of inflammatory response, which then gives you a picture of the dysbiotic profile in the gut microbiome, because that's what is driving these inflammatory responses, and also the immune profile in the gastrointestinal tract and systemically. So I determine the food lists from that. So just getting the pattern of symptoms. And then when it comes to dietary techniques, because we have so many, we've got ketogenic, we have intermittent fasting, we've got more therapeutic fasting, carb and calorie restriction, protein pacing, all of these. So to get the dietary techniques right, and because there is no one size fits all with these, people can really run into troubles. Then I look at the metabolic and hormonal symptomatology. So the types of symptoms, the symptoms that would point to, well, firstly, menopause and perimenopause, adrenal issues, thyroid, cortisol. And then from that, I can figure out what dietary technique is going to work best. So that's about meal timing, meal composition, and frequency of meals. And some people need a bit more, others can do with less, and also the intermittent fasting period as well.
The thing that I want to say, and again, this is not a sponsored episode. I just want to share. This is as a service, because I really believe in functional testing. I really believe in self-advocacy for your health. Is that I've had DNA tests, I've had gut microbiome testing, I've had blood testing, but never in my whole life had I had a personalized nutrition plan. Never seen a nutritionist, dietitian, nothing like that. And when I did the test, and it's really inexpensive, it's like crazy inexpensive, because it also comes with the program. It's $150. And in addition to getting your personalized nutrition plan, you get access to sessions with Dr. Agnes that are pre-recorded that have so many resources. And again, it's not a diet. It's not just for weight loss. It really is to reset your metabolic health, to reset inflammation. It's good for your skin. It's anti-aging. It's so interesting. So if you have any interest in how you as an individual function and can be optimized from a biotech perspective, it's a really interesting exercise to go through. And I'm wondering if you might share, so you explained earlier how you determine that personalization. So you determine the food list as part of this test, you determine what kind of program is going to be best for you, whether it involves intermittent fasting or how long the fast should be. It gives you a shopping list for the foods that you should be on. It gives some recipes of what to eat and with the food groups that you can. Great information on portion control, which is really informative and super easy to follow. But it is not a portion control diet. Nice. It's not that way inclined at all. So if you're hungry, you can definitely fill up, but you just won't feel sick afterwards, and you won't have that thud coming down. But I'm wondering if you could also share with those of us who are listening to the show today what some of the support resources are and why you why you think those videos and those learnings are really key for that fundamental life-changing approach.
Firstly, I think the more you know, the more empowered you can be about your health. And the whole point was really of this program was to give the information that is going to change your understanding of what it actually means to be healthy. Because I think we have a general idea, but not one that's quite specific. And I really wanted to make sure that people understand what factors are involved and what factors need to be addressed to optimize your health. I talk a bit about, as far as the resources go, and testing and biotrackers and biohacking. When I was practicing integrative medicine, I used to, and this was many years ago, I would send patients for certain tests. But the routine was, like you said, the gut microbiome tests, the DNA tests. And I didn't find them all that useful because most of the time they didn't change the management. And the management is to address everything, all the
behavior.
Address it all at once, and then the behavior falls into place. But I do, in the program, I could talk about these and make kind of the ones that I feel are useful. Once, obviously, when you need, before you even start, you need to see your doctor, make sure that you don't have any, if you have any symptoms, that needs to be assessed first and foremost. Make sure you don't have anything urgent or serious that needs to be addressed. But when you're going through the plan, I usually say, do it for 3 months. And really what I'm finding is about 9 out of 10 people will have either complete resolution of their symptoms or significant improvement. And then if there's anything remaining, then I talk about some of the tests that might be useful at that stage. But if you don't address the foundations, having that test and starting these targeted treatments still is still just a Band-Aid. So it's always about addressing the foundations and supporting the processes that we know are declining with age and that we know are affected when anyone has a range of symptoms. So I talk a lot about that. I talk about food addiction, dopamine. Boy, I can't even remember this.
I love the session on dopamine. That I found it so interesting. And again, this is what I'm talking about. Like, it's not a diet. It's got nothing to, I mean, it's almost got nothing to do with a diet. It's about like really understanding at midlife, at a time where, you know, you're getting everything else measured. And if you're really interested in, you know, how this vessel is going to take you on for the next 40, 50 years, it's such an interesting, you know, you talk about brain health, dopamine addiction, physiology. There's so much education.
Yeah.
Honestly, the most comprehensive bio training I've ever seen in my life, and I've never done it before, and I'm really enjoying it. I'm getting like a little mini degree.
Yeah. So yeah, it's a health course almost. I know, because I think you need to become your own health advocate as well, because it's unfortunate. It happens that a lot of symptoms are dismissed when tests come back normal, and then you're just told it's a normal part of aging, but it doesn't have to be. It doesn't have to. You don't have to put up with it. So this is about figuring out what she can do and assessing and understanding your body and understanding the signals that it's sending and understanding what to do as it's sending these signals, because our needs change with our changing environment and our changing life. So you need to really get in tune with what your body's telling you in order to know exactly what you need at that given time. So I talk a lot about that.
What advice do you have, like if you're not on the program, what are some things that you think, you know, someone who's listening to this can explore from today? And it's going to give them a much better understanding of what their body can and can't tolerate and how it responds to things.
I always start with diet, because we're eating every couple of hours and we're changing our microbiome and our immune function with that. And especially for the peri and postmenopausal female, I would avoid or entirely remove processed foods and really just focus on real food, you know, fresh herbs rather than packaged mixed herbs, and healthy fats like olive oil, avocados, lots of protein. So especially in perimenopause, we lose muscle mass quite significantly, and that changes metabolism. So that's actually another factor that's involved in
I'm eating
a lot of
it since I've been on your.
Yeah. So protein, increasing protein, reducing carbs, and definitely reducing refined carbs and starchy carbs, and really getting your carbohydrates from fruit and vegetable sources like pumpkin and beetroot and sweet potato. It's really getting, and the brightly coloured fruit and vegetables, they're so full of polyphenols, and they're antioxidants. When you look at the research into their therapeutic effects, it's quite incredible. And there's now a lot of research coming out about the effects of polyphenols on the hallmarks of aging. Granted, these are animal studies, but some of them have actually progressed to human clinical trials. So it might just be a matter of time. There's no contraindications to eating healthy food. So that's the top priority. There's no contraindications. Go ahead, that would be my first piece of advice. And exercise resistance, regular resistance exercise, because you are losing muscle. Make sure you eat enough protein as well with that, and cardiovascular exercise for that. Cardiovascular health, but don't overdo it because it's counterintuitive in this age group. And look at exercises that down-regulate the stress response, because we're generally stuck in a stress response, a heightened stress response at this age. Yoga, Pilates, and then stress management techniques. So if you can look at the areas of and look at the areas of your life where things aren't working for you, and remove them, just slowly remove them and start focusing on yourself. Because I think women have, by the time they hit perimenopause, a lot of their energy has been taken up on their children, their relationships. Women are caregivers, and they often tend to ignore their own needs. Now is the time to start thinking about yourself and prioritizing your health.
Can I ask you a question? We haven't had this conversation before. What about water intake? How important is water intake, and how do we know when to have it? Because actually, no, maybe you did say to me, because we've dined out together before, and you've told me not to have water with my meal. Talk to me about water intake, because that seems another simple thing that you can adjust and get some good results from.
Yeah, I mean, it's essential. We're mainly made of water, so we need water. 2 litres a day is a general rule, and ideally you would drink 200 mils every hour for the first 10 hours, and I don't get that. I just don't like water. So I have herbal tea all day long, green tea in the morning, then herbal tea in the evening. I don't think I reach the 2 litres. I think, and when I do, it makes a big difference, because if you're experiencing symptoms like fatigue and brain fog, you might actually, they may improve just by increasing your water intake. I had a patient ask me, what's the upper limit there, because you can overdo it. In some countries, they're saying that 3 litres is ideal for the day. So I really did. It's such an individual thing that I would say between 1.5 to 2 litres. That's your target each day, and then you tweak it from there depending on what feels right for you.
One of the things that I've learned that was a big change for me on your diet, and it's kind of contraindicative to other things that I've read or heard about, is to remove fermented foods. So I love fermented foods. I like pickles, I like vinegar, and your recommendation is when you start on the anti-inflammatory diet to remove all fermented food. Can you talk to me about that?
Yeah, there's 2 reasons. One is because they're high in histamine, very high in histamine. I haven't had a patient who did well if they had gut symptoms, especially, or the symptoms that would suggest allergies or histamine intolerance or autoimmune disease. But I haven't had one who did well continuing fermented foods. So a lot of them come to me having just finished a gut healing program and it wasn't working. And that's because fermented foods are recommended, whereas this is something that you need to remove to begin with. And then you can slowly reintroduce them. And
so kombucha, pickle, all of that. No.
Just no to begin with, and then you assess your tolerance. I really love fermented foods and all those, but In small amounts, it's fine. And some people will be able to tolerate more because as your gut microbiome improves and the wall of your intestinal tract becomes, well, the leakiness goes because that happens with dysbiosis, then your tolerance improves as well, and everyone is different. So you can reintroduce them, and there are health benefits. Another issue is that a lot of people have it, particularly people with rosacea. They have what's called, it's very closely linked to small intestinal bacterial overgrowth. So the other reason why I don't recommend fermented foods is because they do have live bacteria. You're just adding to the overgrowth. So you could be worsening your symptoms. So it's not until symptoms are resolved and you're back to normal that you can then test the foods. That's what I generally recommend.
And coffee, your thoughts on coffee?
Yeah.
So that's been a hard one to break.
Yeah, I know. It's the hardest. I know. I stopped 2 weeks ago, and I'm counting down the weeks just because I'm just having a bit of a break. Coffee, it all depends on your tolerance to it. Caffeine. Well, we know that coffee has polyphenols. There's been a lot of benefits found with that, but so does green tea, and green tea doesn't have
But green tea is joyless.
The one I have is beautiful jasmine green tea. It's delicious, but you're right. It's not as nice as coffee, but it really just depends on your tolerance level of caffeine. So some people can get leaky gut with it. It's not entirely without risk. And then if you're adding milk and sugar and all of the barista extras that come with the coffee that you generally drink, then you really run into trouble. You're not getting the health benefits. But black coffee or coffee with almond milk, for example, ideally that you make yourself, because obviously the store-bought almond milk is going to have additives. Then 1 to 2 cups a day, generally people can tolerate. But if you're finding that it's only in the morning, so before 12 midday, because the half-life is quite long, and so you will still be experiencing the effects of caffeine late into the afternoon if you have coffee at, say, 8 or 9 a.m. So it really is about timing of the caffeine, how many you're having a day, whether or not you're having all the extras that could be making things worse for you, and then your general tolerance of it.
You advocate for this smoothie, which is more than a smoothie. It's actually been quite life-changing for me because it packs so many vegetables in. I've never had a vegetable smoothie before, but it kind of tastes like a sweet smoothie, but it's just a vegetable drink. And I'm wondering if you could explain that. I add your My Ally powder to it, but you could also have the smoothie without any supplementation, and it would be quite good for you, right?
Yeah, of course. The smoothie is vegetables and berries or other low-sugar fruit, and without coconut water or almond milk or avocado, MCT oil. So they're the things that I generally recommend. And then essential amino acids, so you're getting carbs, fats, and proteins. The essential amino acids are basically what gives you that protein source. The reason why I suggest that My Ally is taken with a smoothie is because My Ally isn't a food grade supplement. It is just nutrients. So I haven't included.
It's no lady shake.
No, it's not. It's not. I haven't included protein powders or a carbohydrate source. It is just nutrients. And so it does have a particular taste, which I know you know about.
Yeah, it's bitter. I would say that it's bitter. Definitely my tolerance for it has increased. Further to your point, once your brain changes and you know why you're doing something and all the knock-on benefits, you can tolerate all sorts of things.
I have people who take Chinese herbs, which just take and but this is obviously, I put some natural flavors in it, so raspberry, lime, and vanilla. Some people say it tastes like a lime splice, which is nice.
It does not to me.
No, I don't think so either.
No, not to me. But definitely my brain has switched. And funnily enough, when I have my smoothie, and I'll tell you what I put in my smoothie. It's your recipe, but slightly modified. So I put in the zucchini, coconut water, a little bit of fresh ginger, a scoop of coconut yogurt, avocado, lots of spinach, and then a handful of frozen blueberries and the My Ally powder. And I make it up and I have it twice in a day. So I'll have it at about mid-morning. I'll have it at about 11 o'clock, and then I'll have it again at about 4 o'clock. And I find it, I don't know, maybe because my brain has got it into its head that this is a beauty shake.
Yeah.
And it's like, but I don't know. I think my skin has changed. I think I don't get any indigestion anymore. It gives me that kind of brain boost that I need at 11 and at 4. And, you know, I've made friends with my shake.
That's fantastic. So you divide the dose into twos.
Yeah, I just make one
really
shake
big
in the morning
one, and then you
before I go to the office, and then I have it at 11 and I have it at 4.
Yeah, I tell people who find it hard to tolerate the taste, I say just make a bigger shake and have half in the morning and then half after lunch. You just have a slightly smaller breakfast, slightly smaller.
Yeah, I don't taste it anymore. I just like
you get used to it. Yeah,
for sure.
I think most people do.
But like you get so much fiber, you get fresh vegetable, you get, you know, hydration. I love it. So I've come to love it.
Well, I'm glad. I know you struggled with it a little bit to begin with, so I'm glad to hear that.
Okay, speaking of supplementation, if you're not taking the MyAlly supplementation can really mess around with your hormones, right? The incorrect supplementation. And a lot of us have so much information on supplementation. Perhaps we've taken matters into our own hands. We're not seeing a naturopath. We're not seeing an integrative doctor. We're not seeing a nutritionist. We're just taking stuff that we've heard is good for weight loss, good for moods, good for metabolic health. What are some of the supplements that you think we can safely self-dose, and what are the ones that you would urge us to stay the hell away from?
So I generally, in middle age, our nutrient needs increase. So this is where it would be warranted to take something like a multivitamin, definitely fish oil, get your vitamin D levels checked, and if they're low, then take vitamin D. But always check the label for any warnings, because you shouldn't be doubling up on supplements. So generally, if you find a TGA listed formulation, the doses will be safe. And but always read the warnings. I think one of the reasons why people run into trouble is that they are just doubling up on certain nutrients, and even doses that are too high. So certain polyphenols can cause problems if the doses are too high.
For me, zinc is the killer. I mean, if I take too much zinc, my blood pressure drops, and I'm like,
okay. Yeah, so
there are a lot. You know, you would think it's a super safe supplement, but like
not too much for too long. No, and that's the thing. Just make sure if you're not seeing a practitioner for your supplements, and just read the labels. Make sure you're not doubling up on nutrients. Make sure that there aren't any precautions that would prevent you from being able to.
So good multivitamin, a good fish oil.
And vitamin D, I think, would be really, because vitamin D regulates 5% of our DNA, so 5% of our genes. So it's incredibly important. Plus, it's an anti-inflammatory vitamin, which in our age group is essential. It's one way we can reduce inflammation, and low vitamin D levels have been associated with chronic disease, certain chronic diseases. So I think that one is, but if you take too much, then you can become, it's fat soluble, so it can become toxic in the body, and higher vitamin D levels are linked to conditions like rosacea. So you really do need to make sure that you have your blood levels tested, and have a doctor to advise, or an integrative practitioner to advise on the correct dosing for you. So it's not something that I would just go and take over the counter. But fish oil, 1 gram a day, that's fine, and a multivitamin, as long as there aren't contraindications to it, because nutrient needs increase where there's so much damage that's accumulated, and our repair mechanisms and all of our cellular processes are declining, and one of which is mitochondrial function. That declines. That's what produces energy. So if you're feeling tired, it's usually a result of declining mitochondrial function. Fatigue is the symptom of mitochondrial dysfunction.
And the mitochondria is the battery pack, right?
Yeah, the powerhouse of the cells. So a multivitamin will usually address that, because the mitochondria need a lot of different micronutrients as cofactors for that.
I never take a multivitamin, but you're right, a good old multivitamin.
As long as it's a good quality one and TGA listed, because then you know that what's in the product what's on the label is actually in the product. It's tested for quality and stability and for toxins and dose. So that's the main thing.
What about prescribed supplementation such as compounded DHEA, metformin, which is quite popular in anti-aging medicine? And of course, we know about HRT, so we won't go into that in this episode. But what do you think about some of those prescripted or compound medications?
I think they can work very well in the right person at the right time, with the right plans. You would need close monitoring. That's the reality of it. Metformin has a lot of benefits. It helps with insulin resistance. It can help with weight loss. It's anti-inflammatory. It improves the gut microbiome. So there's a lot of new potential indications for metformin, and it's undergoing a very large clinical trial at the moment in the longevity field. But it also comes with risks. It is actually a mitochondrial disruptor. So if it's used in the wrong person incorrectly at the wrong doses, and also timing, it has to be timed according to meals, because if you don't have carbohydrates in your meal, the meal that you take after taking metformin, then it could make things worse as far as your mitochondrial function goes. So there's a lot of factors to consider, and that's why I'm glad that they're prescribed and that someone can then really guide you on how best to take.
Because there's a lot of talk online about berberine mimicking the exact same functionality of metformin. And I know a lot of people that are self-prescribing berberine because they can't get hold of metformin. But supplements can be super powerful and they can be disruptive if taken incorrectly. Am I right?
Yeah, absolutely. And berberine has a lot of incredible effects, benefits. But yes, of course, if it lowers blood glucose and you are on a low carb diet and you're not keto adapted, where your body's using fat as a fuel source, then you can run into trouble. But the benefits with supplements will generally outweigh some of the risks. Whereas with metformin as a medication, it appears that it is a bit more risky. It's very similar. They have similar glucose lowering effects, but berberine certainly appears to be safer if it's at the right dose.
And then the other thing that I would absolutely value your thoughts on is probiotics, prebiotics, postbiotics. You know, can you self-prescribe those? Do they work? What are the benefits and what's the downside?
So prebiotics are fibers that are food for our gut microbiome. They're generally safe to take in supplement form, but if you start too high, if the doses are too high and you don't have the right microbiome, you can get gastrointestinal upset, so bloating, nausea, anything basically. So you have to start low with them, and you have to mix a few of them together rather than just take one, because different species preferentially digest different prebiotics, and you want to increase diversity of the gut microbiome. So prebiotics being dietary fibers are found in foods. So foods like vegetables, crunchy vegetables, apples, green leafy vegetables, things like broccoli as well, cruciferous vegetables, sweet potatoes. So you can find them in food. If you're eating a varied diet, you're probably
would my smoothie be a prebiotic?
Yeah, well, you've got spinach there, you've got fruit, and plus you have the polyphenols, which are also, they're not prebiotics, they also increase diversity of the gut microbiome, so they have those benefits. Probiotics are live organisms that produce a beneficial effect in the body. I don't recommend that people take probiotics because, firstly, what's known is that we have naturally about 160 to 200 different species in the gut microbiome, whereas there are only about 40 bacterial species in probiotic form. So if you're taking them in probiotic form, they will compete with your natural species, especially if you've had antibiotics that have completely a broad spectrum antibiotic that has wiped out your microbiome. If you're taking probiotics, some of your natural species may not grow back because they're competing for nutrients and receptor sites. You need to be careful there.
So how do you encourage the 200 to come back if you're not taking a probiotic, which again is so frustrating because there's been so much marketing and so much attention on take the probiotics, it's going to support your natural gut microbiome.
I know, but there aren't any TGA listed probiotics.
Wow.
Yeah, so that's because the research is it's unclear. There are specific strains of specific species that have been linked to health benefits, but it's not like you're getting that particular strain in that formulation. You have to take care with that. I think that could be left to the specialists. I know in dermatology, for example, there are certain probiotic species or strains that can produce beneficial effects for certain dermatological conditions, but it wouldn't be something that I would be prescribing. What was your other question?
Postbiotics.
Oh, and so postbiotics are basically the microbial metabolites. So the best way to get microbial metabolites is by producing the right gut microbiome with prebiotics and polyphenols, and omega-3 fatty acids also increases. So fish oil or eating fatty fish also increases. The best way to do it is to go to the source. And you asked the question of how do we regain our microbiome after antibiotics. It will naturally, you have a baseline microbiome genetically. We have a specific microbiome. Everyone's very different. And our appendix actually houses the microbial stem cells. So if you still have an appendix, then you can repopulate the bowel. Like the appendix can release these microbial stem cells and repopulate the bowel. Ideally, you want to support it with prebiotics. Adding probiotics, a broad spectrum with a lot of species, might be helpful only in the short term. If you're not including prebiotics, you're not going to get much benefit, and you could potentially change that repopulation. As far as postbiotics go, there is some research in for one of them called butyrate. It's a metabolite of the microbiome, but it is beneficial for gut disorders. It's found to be beneficial for gut disorders, not for systemic as much, because the systemic absorption isn't there. It seems that it comes straight out, but still, it's better to get it in that from the gut microbiome itself, rather than taking something that's exogenous.
Well, I think we've covered so much once again. Oh gosh, not even the surface, but I'm going to add links if anyone is interested in getting their personalized nutrition plan. I would definitely encourage you. It was quite illuminating for me. And once again, it's not a diet. Yes, if you wanted to, you could use it for kind of resetting your metabolism and weight loss, but it is kind of like a reset. I would consider it like if you're willing, it's a very comfortable whole body reset. And winter's coming, so it's not a bad time to do it. We don't have as many social obligations. It's kind of easier to do a little experiment on your body. And I found it to be quite fun as well. Like, apart from giving up a few things and watching myself have an addict's reaction to just saying goodbye to gummy bears. It is actually super fascinating, and you see the benefits almost immediately. I would say after 2 days, I started seeing things like improve for the better. Dr. Agnes, thank you so much. I love seeing you. I love speaking to you. I love learning from you.
Thank you. Thank you so much for having me. Thank you. And there we have just scratched the surface, haven't we? From that menopause perspective. One thing I just wanted to kind of finish up with is that when we think of menopause, we think of hormone replacement, but it's so much more than just hormones, because it's not just a hormonal transition. It's an immunological one, it's a neurological one, and it's a metabolic one, and everything needs to be addressed. So,
well, that is such wisdom. And I would say that anyone who is a menopause specialist is also preaching from the same book, but perhaps without the experience and the depth of knowledge that you have on this topic. So I'm really delighted to add this additional piece of the puzzle to the menopause conversation. And I will share some more of Dr. Agnes's resources as part of this conversation, because I think they're well worth exploring. Thank you again. Wonderful to see you.
Thank you so much.
Yeah, I'll see you soon.
See you soon.